Hello, this is Dr. Grande. Today's question is, what is motivational interviewing? So motivational interviewing is a therapeutic modality that was developed by a researcher named Miller in the 1980s, specifically to treat substance use disorders. Now, since that time, another researcher named Rollnick has worked with Miller and they've advanced the theory. So motivational interviewing is quite a bit different than a lot of other modalities. And it's really not the same thing as we would think of with the traditional modality like cognitive behavioral therapy, reality therapy, existential therapy. It's really more of a brief therapy, and it is narrowly focused on substance use, or sometimes it's used with other issues where motivation is considered central to making some sort of change and to seeing relief from symptoms. So in motivational interviewing, we have a person-centered way of being, an empathetic way of being. It's not the same thing as person-centered therapy, but the way of being, how the therapist relates to the client in terms of empathy and active listening, that's very similar to person-centered therapy. In motivational interviewing, the therapist works to expand the gap between the choices an individual is making and their behaviors and their goals. Now, a lot of times, of course, we think of this gap as existing with substance use disorders. A lot of clients look at substance use as having benefits, and of course it has obvious drawbacks. So the substance use interferes with accomplishing goals. So the behavior and the choices that are made don't line up with the goals the client would have, meaning using substances isn't conducive to progressing with relationships, progressing with career, remaining physically healthy, remaining mentally healthy. So a therapist using motivational interviewing will help explore that ambivalence. Ambivalence is when an individual has strong feelings in opposite directions. Also in motivational interviewing, a therapist rolls with resistance. Oftentimes in other modalities, when resistance is encountered, the therapist will try to counter that resistance. In motivational interviewing, the therapist goes along with the resistance. Also, successes in the past are highlighted in motivational interviewing, in a way like solution-focused therapy, to show the client that they have the inherent ability, the intrinsic ability to change. This is really a key feature of motivational interviewing. Unlike other modalities, like cognitive behavioral therapy, motivational interviewing views the client as having everything they need to make the change that they want. There's nothing really missing from the client. The motivation simply needs to be explored and enhanced. And again, that's a lot different than many modalities. Now, there are some other elements to motivational interviewing we see. For example, the stages of change. Now, motivational interviewing wasn't really based on the trans-theoretical model of change, as a lot of people believe. But it does use stages of change, and when we see motivational interviewing used in practice, that's a very common element. Now, there's not agreement on exactly what the stages are, but generally we look at the stages as precontemplation, that's when somebody's not considering a change at all. Contemplation, where the ambivalence is building. Preparation, where they're getting ready to make a change. Action, that's when they make the change, and maintenance is when they continue to behave in a way to make sure that change stays in place. Of course, with motivational interviewing, that would be remaining abstinent from substances, or in some cases, using a much smaller amount of substances. This is called harm reduction. Now, where the disagreement comes in is the last stage of change. Some models don't have a sixth stage. Other models have termination as stage number 6, and still other models have relapse. So it's really normalizing relapse. Relapse is common in substance use treatment, so some have added that as a 6th stage of change. So some other features of motivational interviewing we see, there's a couple acronyms. One is OARS, O-A-R-S. This is open questions, asking open-ended questions instead of closed questions, meaning questions that would require a little bit of an explanation, not just a yes or no, for example. Affirmation, reflective listening, and summary reflections. So that's the OARS. Another acronym we see is RULE, and this is resist the writing reflex, that's the R. And that means in therapy a lot of times when we see something wrong, we see something obvious that should be corrected or we think should be corrected, there's this reflex to jump in and try to fix it or to help. In motivational interviewing, a therapist using this technique would resist that writing reflex. The U in RULE would be understanding the client's own motivation. So in motivational interviewing, the therapist isn't an expert, the client's an expert. So it's important that the therapist understand the motivation that the client brings, wherever that motivation is. The L is listen with empathy, and the E is empower the client. So again, this goes back to autonomy and the idea that intrinsically the client is bringing everything they need to bring to make the change into the session. So in 2009, Miller and Rollnick wrote an article where they talked about what motivational interviewing is not. And when I go into some of the limitations of motivational interviewing, which I'm going to do now, I'm going to be using some of the elements they highlighted in that article. So it's important to understand with motivational interviewing, it's really difficult to categorize some of the features of this theory as negative or positive because there is a lot of disagreement over how to treat substance use disorders. Meaning, elements I might look at as a limitation could be considered a positive by somebody who really has invested into motivational interviewing. I can appreciate that there are a lot of differences. Really, when I list the limitations of motivational interviewing, it's more or less my opinion and based on, again, work of Miller and Rollnick and some other researchers that have written articles about motivational interviewing. So motivational interviewing is not a version of CBT, and it's not just person-centered therapy. One of the difficulties I have, and I would consider this a limitation of motivational interviewing, is that it doesn't really add anything. There's no role of the therapist as an expert, and I can appreciate that that's not always a popular way to look at it, but even as somebody who can add information to a session, it's really just enhancing that ambivalence that's already there. I view this as a limitation. I can also see in some situations it could be a positive. So again, it kind of highlights this feature of motivational interviewing where it's tricky to record it as just pros and cons, to categorize it that way. Another element of motivational interviewing, and I do look at this as more of a clear limitation, is that it is complex. There's no standard format in practice. There is a standard format, of course, to motivational interviewing, but not in practice. It's particularly complex, and on top of that, it's considered to be brief. As a matter of fact, Miller and Rollnick indicate that 2 or 3 hours of motivational interviewing is all that a client could really tolerate in many cases. So it could go from one 50-minute session, or maybe even a 30-minute session, all the way up to 2 to 3 hours. Now, Miller and Rollnick acknowledge that it's not a comprehensive approach. So really even comparing motivational interviewing to reality therapy or psychodynamic therapy or a version of CBT like rational mode behavior therapy, it's not really a balanced comparison. Motivational interviewing isn't a technique, but it's also not a comprehensive approach. Some areas I think are a little clearer in terms of limitations and positives to motivational interviewing. The research on motivational interviewing in terms of its effectiveness is, I think, in favor of motivational interviewing, but it's still mixed. It's not really clear how effective it is for substance use disorder treatment. Overall, as I said, I think it's reasonable to interpret the evidence as leaning more positively. But I think this mixed research is a problem for motivational interviewing. With some of the articles that both support and do not support motivational interviewing, the methodology is a little questionable, particularly in terms of the selection of participants. So I think more research is really needed, but right now I view this as kind of an unclear area. Now, another area that I look at as a limitation is more about how motivational interviewing has been used than what it actually is. Now, motivational interviewing, as I mentioned, I believe is effective in many cases for substance use disorders. But there has been lately an expansion of motivational interviewing, I think because of that success, into a lot of other areas, into treating mental health disorders and symptoms that don't really have the same clear connection to motivation that's theorized with substance use disorders. So I view this as a problem. I don't believe there's enough evidence right now to take motivational interviewing into a lot of other treatment areas. I think keeping it restricted to substance use disorders while research continues makes sense, but it has expanded. So another limitation of motivational interviewing, and really this is more of how motivational interviewing fits in with substance use treatment, is there's another theory out there called the disease model. And it's not really a treatment theory, but it's just a theory of how substance use disorders take hold and how they progress. And it's not nearly as focused on motivation as we would see in motivational interviewing. So it becomes difficult with motivational interviewing is how it fits in with the disease model and how it fits in with 12-step groups. So really, I look at motivational interviewing very much as at odds with those two other philosophies, those two ways of looking at substance use disorders. I view them as three distinct theories that can be used together, they can be integrated to some extent, but it's not really clear how motivational interviewing fits in really well with the disease model and with 12-step groups. So again, this isn't necessarily a limitation of motivational interviewing, meaning it's a bad theory or doesn't make sense. It's just not clear how it fits in with those other theories. I think this is really a limitation of substance use treatment in general. There's disagreement in the community about how to look at substances and treating substance use disorders. All this controversy in a sense is healthy because it keeps a dialogue going about what causes substance use disorders and how we effectively treat them. But it can be a hindrance too, as certain theoretical orientations don't have a clear way of fitting in. So in terms of the clear positives for motivational interviewing, I like the brief aspect of motivational interviewing. I like that it expanded on person-centered therapy. I don't view person-centered therapy as a comprehensive modality, but of course the way of being I view as very valuable. So having motivational interviewing expand on that, I think makes sense. And I really like how motivational interviewing can be integrated into other modalities. I actually think that's arguably its highest and best use outside of just substance use disorder treatment. The elements of motivational interviewing, the stages, the summary reflections, the non-judgmental stance, understanding the client has ambivalence and how to work with that ambivalence, how to roll with resistance. These are all valuable techniques, and I do like how they integrate into other theories. I view this as a key strength of motivational interviewing. I hope you found this description of motivational interviewing to be interesting. Thanks for watching.